Hi everyone, Dr. Suneel Dhand, medical doctor. Welcome to another video. I want to talk in this video about 5 things that I would be doing at a doctor's appointment, particularly a first doctor's appointment, to tell me whether this is a doctor that I really want to work with, who I want to be in charge of my health and well-being, the most important thing to me, or whether it's a doctor who I really want to run a million miles away from. And I talk about a lot of issues like this. I share other tips and advice as well as details about my other escapades away from social media in my regular free newsletter. For those of you who aren't already signed up for that, link is in the description down below. Now, I really feel the pain of so many people out there, many people watching, who comment on my videos about their stories, and I have many family members and friends who are in this situation as well. It is so difficult to find good doctors out there. And the healthcare system is absolutely terrible. It doesn't give doctors enough time with patients, assuming the doctor works within the system where the government or insurance companies are dictating exactly what to do. So people are really stuck. But I would still urge you, your health and well-being is simply too important to settle for second best. And you must know whether your doctor is someone you want to be in charge of your health and well-being, or whether you should keep looking for different doctors until you find a good doctor. And again, I know it's really tough out there, but you owe it to yourself and your future to keep trying. So on that note, let me dive in. 5 things that I would be screening for during that first appointment to tell me whether this is a doctor that I really want in charge of my health and well-being. Number 1, watch how they first greet you. There have been a lot of scientific studies on the time it takes to form a first impression, to get a gut instinct, whether you like somebody or not, whether you can trust them. And do you know that studies show that as human beings, we have an innate ability very quickly to judge somebody and form a first impression. Of course, first impressions aren't always right, but a lot of the time they are right. And studies show that it only takes 1/10 of a second, believe it or not, to form a first impression of someone. Now, I'm not saying whether things will happen that quickly for you, but I think definitely during the first few seconds and first minute, what is your first impression of that doctor? Did they seem like somebody who greeted you warmly, who made you feel instantly like they are there to solve your problem? Did they radiate compassion? What does your gut instinct tell you? Because if your gut instinct is wrong about this, if you kind of got the impression that your doctor isn't really interested, just wants to get through the day, isn't totally focused on you, then that initial gut instinct within the first few seconds is usually right. Number 2, watch very carefully how they communicate with you. Are they distracted with their screen? Are they turning around, ticking their computer boxes? I don't care how much bureaucracy there is simply no excuse for a doctor coming across as disinterested and more interested in their computer screen. For want of a better term, I think way too many doctors are absolutely crap communicators. They have no idea what a privilege it is to be a doctor, to be in a position where people are coming to them for help, and they must take that responsibility seriously. Are they looking you in the eye? I mean, we're talking about very simple things here. Do they give you the sense of empathy, of wanting to help you? What does their facial expression tell you? But very importantly, you want them not to be distracted. They must be giving you their full undivided attention. And as far as I'm concerned, when a doctor and a patient are together, which I consider a sacred interaction, that doctor should be giving you their full undivided attention. So what is your sense on this? Number 3, I want you to ask them a very specific question. No matter what the specialty, whether it's general medicine, whether it's cardiology, whether it's gastroenterology, pulmonology, nephrology, I don't care what the specialty is, even if they're a surgeon. I want you to ask them at some point during that consultation, what do you think, doctor, about the importance of food and nutrition to solve health problems? Because if they are a real doctor, true to the principles of Hippocrates, who, let's be quite honest, knew this 2,500 years ago, and up until 100 years ago, but especially the last few decades when the medical profession went entirely nuts and became driven mostly by big pharma, doctors would tell you immediately that food is everything. Food is medicine. Every cell in your body, every thought that you have is powered by what you eat. And a good doctor will immediately say, absolutely, food is everything. Nutrition is so important. If your doctor even gives you a hint of passing this off, oh, it's no problem. And believe it or not, I've heard stories about gastroenterologists telling people that what they eat doesn't matter for their condition. Now, I'm hoping that's a minority of gastroenterologists, but I've heard that story more than once. Can you imagine a doctor of the gastrointestinal tract thinking like that and not understanding basic things like how processed food is pro-inflammatory? But regardless of the specialty, your doctor should immediately jump all over this. If they're a good doctor, they will understand that food, what you eat, is absolutely everything. Number 4, how does your doctor think about the medications that they are prescribing? Sadly, our current system, it's almost like a doctor is writing on a prescription pad or typing out on their also important computer entry system what medication to prescribe as soon as a patient is walking through the room. Totally ridiculous situation, but that's how modern day doctors are thinking. Collectively, the minds of the medical profession are broken in this regard. But I want you, assuming a prescription is being dispensed, to ask your doctor right away, can you tell me the side effects of this medication? And watch the doctor's reaction, because a good doctor will immediately be very thoughtful and will say, oh yes, this is a great question. Let me go through the side effects, and this is what I've seen in certain patients, and it's important that you should know this. But it's really important that you should screen for how your doctor deals with this question. Do they understand how important it is, and do they really want you to know the side effects? Because every medication out there has side effects. Number 5, and I would say this is the most important one. I want you to ask your doctor, no matter what the diagnosis is, doctor, is there anything else that I can do naturally to help? Again, if you have a good doctor, they will be all over this. They will say, absolutely, you should be eating like this, get outdoors, get some vitamin D, get some social connections, do something in the community. I mean, if you're talking about something like mild depression, for instance. But I remember when I was growing up, doctors were all in on this. It was actually very difficult. I mean, this wasn't that long ago. But I really think the medical profession has gone completely nuts over the last 20 to 30 years, whereby everything is about a pharmacological solution. But ideally, if you have a good doctor, your doctor should be excited about telling you about all the natural things you can do. Again, whether it's getting outdoors, what you eat, proven natural supplements. That's another way that many people experience benefits. But whatever it is, there are a ton of natural things that can help with almost any condition. So that would be my last screening question. Let's go over those 5 again. Number 1, how do they greet you? Do they give you positive vibes? Number 2, how are they communicating with you? Do they give you undivided attention? Number 3, ask them, what do you think about the importance of food for this condition? Number 4, as soon as they prescribe you a medication, first question, can you tell me the side effects of this medication? How into this question is your doctor? And number 5, no matter what the diagnosis, ask your doctor, doctor, is there anything else natural that can help? Because a really good doctor out there who understands metabolic health and how issues like mitochondrial dysfunction, oxidative stress drive almost every illness via inflammation, your doctor will be all over this because there are so many natural things that can help. And I understand that a lot of people out there might think that a pill will fix them, but it doesn't help if the medical profession is also giving that impression that we have pills and injections to cure everything without emphasizing all the natural things that can be done. And I am of the belief that the medical profession is not all in on this. If a doctor consistently tells their patient to do something natural and emphasizes it in a compassionate way with empathy, then many, many people will follow through with that if it comes out of a doctor's mouth. But sadly, these things are not coming out of doctors' mouths enough. So I wanted to share with you in this video those 5 things. And once more, my goal personally, as I've said many times, is to stay away from doctors and the medical industrial complex. As far as I'm concerned, going to a doctor is a last resort. Of course, if something's urgent, if there's a red flag symptom, I would encourage anybody to go to a doctor. The medical profession may be good at fixing acute things quickly, but there are many things for which the medical profession is absolutely terrible at. I believe managing chronic diseases is one of them. So many chronic diseases out there are in and out of the door, and patients are not coached properly. They don't know alternative options. And too many doctors actually, regardless of the suboptimal system, I don't believe are up to speed. And I don't believe they are doing their jobs properly. So I'm rooting for you all to succeed. This is too important. And if you suspect that your doctor doesn't tick these boxes, maybe you've had a doctor before who doesn't tick any boxes, then run a million miles away, because your health, your well-being is simply too important. Keep on looking. There are good doctors out there. Get recommendations from people, get advice from other sources wherever possible. Online, there's a lot of doctors who will be dispensing advice, but use your own judgment on what is a good advice, what isn't. Listen to what other people say. Okay, everyone, thanks for watching. I hope that was helpful. Feel free to leave a comment down below. Check the links in the descriptions down below for my website, all the other work I do, and our natural supplement store, my uniquely formulated natural supplements. And if you enjoyed this video, you will also enjoy many of my other videos on natural ways to treat illness and also stay as healthy as possible. Hit the like button if you like this video, the subscribe button for more similar videos in the future, and we will speak again very soon.